I was watching a TikTok video the other day, and the woman in the video was basically telling women who are younger to do everything possible to not gain weight because of several reasons. One of them being that it's very hard to lose weight once you get into your 30s, and also was talking about the social implications, that the fact that it's easier when you're skinny to get opportunities, things like that. And I did a video kind of stitching it, but I wanted to talk a little bit about the reasons why it might be difficult for you to lose weight when you're in your 30s, okay? And I did agree with some of the things that she was saying, mainly about, staying fit and doing everything possible to be active to stay skinny. But I think women don't realize that there's some things that they really can't control when it comes to weight gain. So we'll talk about that today. So the first thing is that as a woman, your body is going to make you gain weight during certain periods of your life. So the first time is going to be during puberty. This is because, puberty. You're growing, you're developing sexual characteristics, you're getting your period. And so during that time frame between the ages of as young as 8 up until 16 for women, you're going to be in a growth phase, and it is very important for your body. Your body uses insulin. So your body uses insulin to help you grow. Okay, so you're going to have what we call physiological insulin resistance. This means that your body is literally making you gain weight. So you can gain weight in your breast area or grow breast tissue. So you can develop hips and a butt. And right, and also so you can develop a little bit of weight or fat in your lower belly area. Okay, all of this reserve of fat is useful for hormone production. Okay, so if prior to puberty you were not eating healthy, or if you are predisposed to obesity, for example, then what could happen is that once puberty hits, you might start to have issues with weight. Okay, and again, it's really not something that's under your control. Now, it is advantageous to be as fit as possible because you don't want to develop insulin resistance in your muscle. But in that situation, you really don't have too much of control. So for the young people who are watching this, like, if you gained weight during puberty, it wasn't your fault. It's just what happens. But you definitely need to make sure you stay active as one of the options for trying to maintain your weight. Most of it is going to be nutrition, like 80%. And we can talk about that in another video. So that's one instance where you're going to gain weight. The second instance, again, as a woman, is during pregnancy. And for me, this is what led to my weight gain and why I became so passionate about understanding weight loss, especially in women. Because I gained most of my weight during my 2 pregnancies. So let's talk about weight gain during pregnancy. Your body, again, goes through a state of physiological insulin resistance, and the goal is to give you extra calories so you can grow your baby, okay? And the pregnancy and postpartum period is very, very difficult because you are insulin resistant and you're growing this baby, right? So a lot of women, if they're not healthy prior to that, they might see that they're prone to gestational diabetes because of that forced insulin resistance. But you're growing this baby, and then once your baby is born, all of your hormones go to like zero, like everything's gone. You're basically in a state of perimenopause. And we all know, if you don't know, but whenever someone is in a perimenopausal state or in a menopausal state, they have a really difficult time losing weight. Add the fact that during postpartum phase, you're not sleeping, right, which we'll talk about later. You're not sleeping, so you're not getting adequate rest. So your body's going to think that you're going through some major stress, which it is, and it keeps your cortisol levels high. And cortisol is an anti-weight loss hormone. So there's a lot going on. Your hormones are not where they need to be. Your cortisol is high, and for some women, that's going to make them eat a lot more. And you might think, yes, I'm eating more because I need to breastfeed, and but there's just a lot going on there. So the whole postpartum period, like from the time that you get pregnant to the time that you till 2 years after giving birth. That's the time frame it takes for your body to get back to normal, right? And so let's say you have multiples, then you extend that time, and so then you're in a state again of insulin resistance, which insulin resistance promotes weight gain. And so it's very, very difficult in your 30s specifically, because I feel like that's when a lot of women nowadays are having children. They struggle so much to lose weight during that period because they've gone through periods of insulin resistance, and then at that point they're not really sure how to lose the weight. So what happened with me, for example, I had 2 kids, and they were like back to back, so like less than 2 years apart. And when I finally was like, I'm ready to lose weight, everything that I did to lose weight didn't work. Everything that I did. And I'm a doctor, so you can imagine my frustration, where it's like everything that I learned about weight loss was, eat more. Sorry, not eat more. It was move more, eat less, right? So I did that, and I was not losing weight. So I had to go back to the drawing board and try to understand, like, why is it so difficult in this period of time for us to struggle with weight? And it's that perimenopause, So if you're 25, for example, and you start having kids, and you are done having kids at like 30, 35, okay? So during that phase, you have periods of perimenopausal symptoms, right? Your libido is not great, you're dry, you're gaining weight, you're having a hard time losing weight, especially if your cortisol levels are high, or if you don't have adequate support to help you get enough sleep, right? And then for a lot of women, again, we go through perimenopause much earlier, so it's not out of the norm to see a woman go through perimenopause around 30 or 35. And so again, there's an imbalance in your estrogen, progesterone, and that in itself is going to cause a lot of issues with sleep. And sleep is a huge problem for weight. And so if you're not sleeping, if you're not getting enough sleep, then again, sleep is going to increase your cortisol levels, and cortisol is going to increase ghrelin or activate ghrelin, and ghrelin is going to make you eat. Okay, so lack of sleep directly correlates with weight gain, and the 30s I feel like is the time frame when women really struggle with sleep. So it's not so simple to just say, stay fit and not gain weight, because it gets harder. It's just understanding why we're gaining weight in our 30s, right? And the main reason, well, there are many reasons, which I can talk about in another video, but one of the main reasons is going to be because of our reproductive health and where we're going. So in your 30s, again, you're having children, so that's one part of it. That leads to high stress and not getting enough sleep, which is another reason why you're going to gain weight. And then the third thing is that you're in a state of perimenopause. It's temporary, but for some women, it just extends into the real perimenopause, and then there's another struggle with weight gain. So that's basically what I want to talk about, and I want women to understand that it's not so simple, and you definitely need a tribe to help deal with all of that. But don't beat yourself up and say that it's not working. What do I need to do? The answer is not going to be fitness. I think fitness is what comes after you have dealt with the stress and you've dealt with the eating habits. And once you can deal with the eating habits and you can deal with the stress, then you can go and try to focus on fitness. So that's my hot take. I'm gonna try to do these types of videos where I'm not so scripted, because I find that it's easier for me to just turn the camera on and talk, and I do that on TikTok and it does really well. So I'm gonna try it on YouTube and just pick a topic related to either skincare or weight loss and talk. Okay, so let me know below if you like this type of video. Subscribe to my newsletter. I tend to email pretty often, just sharing my thoughts on either skincare or weight loss or anything women's health related. And if you're interested in weight loss or losing weight, I have a course that's coming up soon, so I'll link it below so you can sign up, and when it's ready you can purchase. All right, I hope you have a great day, and let me know if you want me to talk more about like the weight loss struggle and all of that.